past history, write nothing.
Yeah.
Is that right?
Yeah.
Okay. So that's good for me, is in that this is a normal, what you were born with knee, and this has had some slight alterations knee. Yes? Okay. So I'm just going to check your knee, and I just want to feel your range of movement on both sides too. Does that feel okay there? So that's quite a bit of extension, isn't it, normally? Yeah.
That's the body is normal.
So I just want to feel this one as well before we move into that. Does that feel okay?
Yeah, it's okay. But it's
Different,
stiff
isn't
in
it?
the air range.
Yeah, and post ACL you often have that people have that very end range tightness. It just feels a bit different.
Yeah.
So it does feel a bit more stiff than that one did. Okay. So let's start. So PCL, the first test you're going to do is a Reprobatum test. So that is literally just lifting and checking the extension on both sides. Now, although you've got a lot of movement, it is even. So that is normal for you. Now, other people, it might be like this. That's the PCL, okay? But yours, you have even movement. Now, if we test your sag test, if we bring your legs up into this position, the other one as well. Okay, now, we should have talked about this before I started holding your knees. So in this position, if the PCL was injured, what would happen to the tibia? Drop down. So you would have less obvious tibial tuberosity and less knee joint line. So your job is to hold the legs vertical so gravity can work down on the tibia, and you need to be able to see this way. So this test is fine, but I don't feel very good at doing it because I'm not strong enough. I haven't got enough strength in my arm to hold that in 90-90 and control the femur as well and look at that. So if you wanted to use that test, you can, but you could put a chair up there, get you resting with your heels onto a chair or a box and have a look at it that way. So it is an option for a test, and maybe it depends on a larger male with a smaller female. You could do that test effectively, but if you're going to do your testing, you want to make sure you're going to get some good information from the test. So then from there, we can look at it in this position also. So you want about 90 degrees with knee flexion. So again, you want gravity to help you. And I tend to do the sag test in this position and just looking at the tibial tuberosity and does it look even there? And we'd say, yes, that does. Then we'll take this one out of it. We're not assessing this one at the moment. And then I'm going to sit on your foot and we're going to do a posterior draw test. Okay? So first of all, I'm feeling the knee joint line. So I've probably got, half a thumb's width of joint line that I can palpate. If the PCL was injured, would I feel the joint line more or less?
No.
Is the tibia sitting forward or back? Back. So what am I feeling? I'm feeling the tibia. If it's sitting back, less. Less. So the tibia would be back here. So I'd have no joint line here to feel, or less. Okay, so that's the joint line there. So for a PCL, just make sure you're starting from a neutral position and you're going to be pushing backwards. But with the test, if you start by just pushing really hard, you're not going to get any sense of play in the ligament. So you need to relax through the hamstrings, and then you'll check where neutral position is, and then you're going backwards in this position. So it's mild, gentle, firm, and I feel like that is a nice end feel, and then I might give a bit more push like this, okay? So then if we compare to this side, So again, tibia, I'm feeling about half a thumb joint line, so it feels similar to the other side. And just get an idea of the play there. And then to feel the end feel of the posterior cruciate ligament, I need to push in an AP position. My hands are sort of cupping around the tibia border at the front here. So I've got a nice firm position there, relaxed, and then going into that position there. And that feels nice and firm, so now I'm going to give it a bit of extra pressure. Okay? Perfect. Okay, so let's go straight into ACL testing and then you can do the whole lot together. So with your ACL tests, I'm going to start with your anterior draw. So again, staying in that 90-90 position here, 90 degrees here. Same handling, but obviously I'm going from PA now. So in this position, I'm getting an idea of the excursion in an anterior direction. So you can see that moving forward a little, and then it stops. So then I want to get an idea with speed, and I feel a nice firm end feel. From there, I'm going to move into a Lockman's test. Lockman's, I'm going to rest your thigh onto my knee. Palpate the anterior tibiofemoral joint line so I can feel any movement there. And this hand, I'm around the back of the tibia, pulling forward. Remember when we were talking about our non-physiological accessory movements? With these movements, you have to go along the joint line, so I have to be pulling this direction here. So with this movement, if you are getting movement like this at the heel, they're either not relaxed enough or the direction of your force is incorrect. So just make sure it's isolated to the knee joint only. And again, if you are trying to test any ligament, you want to stabilise the proximal end firmly, move the distal end only, okay? Can't be stretching both ends at the same time. So I'm just going to go slow first, so mild, medium, firm to get a feel of that. And now I'm going to just do it at speed. Good. Feel that? So it's a nice firm end feel. Some people you get a very definite bang. You know, it moves and then it stops abruptly and almost can feel it. And also in my head I'm thinking like there's a boat and it's tied to a jetty with a rope. The rope is loose, it's loose, it's loose, and then when it gets to the end of the rope, it's bang, it's tight. Okay? That's when your ligament comes into play. It doesn't have to work all the way through the range, it just has to work when it gets to that end of range. So when you're doing these, you're not going to feel anything, feel a bit of movement, so that rope is tightening up, and then it is firm. Okay? And you want a nice firm end feel. So, should we compare with the other one?
Yeah. I think that's more stable.
Be good. Be good. So first of all, let's do the anterior draw. So when I'm doing this clinically, I'll do all of my tests on one side and then I'll do it on the other side. So they'll know what they're expecting, and I'll sit there and we'll do the anterior and posterior draws straight after each other. For the purposes of what we're doing, we're going to practice them separately. So nice and relaxed through here. So I'm just going to give that anterior draw. So again, you can see movement, but remembering movement's normal, so that's okay. And it feels like a nice firm end feel there. I'm not getting a lot of movement there. Now I'm going to do it a little bit faster. You comfortable with that? Yeah? Good. And it's got a nice firm end feel. So good work. Good work, surgeon. So nice firm end feel there. I'm very confident with that. So then we go into your Lockmans. So knee relaxed, feel the anterior joint line, feeling firmly underneath the tibia, so get a good hand around. Now for girls with smaller hands, you're just going to have to come around and really try and get your body over it, but you should be able to do it. Just use your whole hand. I usually can get my hand around like that, but you may have to get your hand around like that. So nice and close to the knee joint line, pulling along the line of the tibia. palpating the anterior knee joint. Mild, medium, firm. Yeah, you're good. And then firm. So you can feel the movement, but it's got a good end feel.
Yeah.
Yeah.
Similar.
Yeah, similar. Good. Perfect. Now, stay there. We're also going to do a pivot shift. So, pivot shift test is something that is good to have in your battery of ACL tests. So, we're talking about the sensitivity and specificity of tests. Some tests may give you a little bit of information. You might want a next layer to see if you can get a bit more information. The pivot shift test, some people love using it, some people don't. I think a course like this is where you need to give yourself the opportunity to practice it on each other, because then you can practice it on your clients and get your handling good. And then if you need it for clinical reasons, you're going to feel confident with your handling. And you need to have confidence in your handling with someone you're suspecting has got an ACL injury, because they want to know you know what you're doing. So with a pivot shift test, you can hold down here and move up and down like this, or you can hold with the ankle tucked into your side and both hands around the tibia. Now it's important you're not blocking the knee movement, so you can't hold over the knee, you've got to hold the tibia here. Approximate the femur into the hip joint, so you've got a nice stable leg. Internally rotate and valgus stress. You okay? Now I'm going to go from this position where I've internally rotated at the tibia. We have subluxed the femur because of the ACL, if the ACL is not intact. We have subluxed the femur posteriorly, and as we come into flexion and the tibia moves posterior to the knee joint line, the tibia relocates onto the femur. And at that point, you may get a feeling of apprehension, you may get a feeling of shift, it may reproduce pain, you might get a dimpling around this area. That's the things that you can be looking for. So, nice stable leg by putting some pressure into the hip. Both hands here, stable here. Internally rotate the tibia, valgus stress, knee flexion from 0 to 30 to 40 and coming down. Now they need to be relaxed, and I'm looking at that face going, I don't know if that's relaxed, but that's the test, okay? So that's a pivot shift, okay? So are you worried about this one?
I'll just go for it.
But are you worried?
A little bit.
A little bit. And we'll go slow, and if it doesn't feel comfortable, we'll just stop. Easy.
Okay.
Yeah.
Maybe I just
I
have
have-
valgus.
Yeah, okay. All right. So first of all, let's just test that. How does that feel to you? Does that feel all right? Does that feel all right?
Yes.
Yeah? Okay. So if we go approximate, internally rotate the tibia, valgus stress of the knee. Now keep that pressure on and coming up into knee flexion. How did that feel?
It feels better than my right side.
And this one? That feels okay?
Yes.
Good. So this is not a test at speed. What we're doing with this one is different to the other tests that we have just done. With the other tests we have done, we've had two ends and we're trying to pull it apart, okay? In this test, when we internally rotate, the femur subluxes posteriorly. As I flex the tibia up, flex the knee, and the tibia moves up, the ITB moves posteriorly and it pulls the tibia back onto the femur, okay? So it's a relocation test. It's not a pulling the ACL apart test. Does that make sense? Okay, so your tests, you've got them in the list. I'll put this ACL ones up there in a sec. I want you to practice your PCL tests first, and then your ACL tests. Okay? Good.